Hey family, this is Dr. G with Be Organic with Dr. G. I want to thank you guys for watching, for liking, for commenting, for being a part of these videos. I do them for you. Today's video is going to be about breathing. Now, the reason why it's about breathing is because if you've ever had that sharp stabbing pain right here, right inside the shoulder blade, sometimes it comes up the neck, sometimes it wraps around the body, and sometimes people even mistake it for a heart attack. Now, a little disclaimer, make sure if you ever have the signs of a heart attack and you think that it may be possible, you need to go to the emergency room. Go see whoever it is that you need to get it checked by, because this may not be a rib. But most common signs for a heart attack: pain in the chest, coming up into the neck, coming up into the jaw, and going down into the arm. If you're not having all of those things, some of it sometimes can still be a heart attack, but that's not what this video is about. This video is about that sharp stabbing pain that a lot of times it can freeze you in your tracks. It can make it feel like there's a hot ice poker just stabbing you in the back and you can't move. You feel like you're like this and nothing can help you. Guys, chiropractic care can help that. We can adjust the ribs. The ribs get stuck just like the spine does. So we want to make sure that everything is moving. Now, like I said with everything, every single video that I do, the number one thing you guys got to really understand is you have to be adjusted. The number one most important thing with everything is the body has to move, and it has to move right. The spine has to move right. It doesn't matter how many exercises, yoga, Pilates, stretching, icing, heating, ice baths, all that stuff is great. And it's all great with the adjustment, but none of it is specific to the spine. Getting adjusted is the only way to do that. Now, the reason for this video, again, we need to teach you how to breathe, because one of the biggest causes for these ribs to go out is when we are breathing with our chest. Now, probably in maybe middle school, late elementary school, we all learned from society that, oh, well, we can't look fat, so we got to suck in our stomach, and we end up breathing with our chest. Now, that's not the case. Nobody really cares. We're all just trying to live a happy life together. But when it comes down to it, we teach ourselves at such a young age to breathe differently that as we keep going and it gets older, it creates problems. It creates a weak core, which in turn turns into a lot of times lower back pain, because back here gets atrophied. Because when we do breathe with our core and we breathe with our diaphragm, that air actually is supposed to go back into our lower back here. So when we have this, we want to try and get our body to breathe together. And that means it needs to communicate together, because the only thing that connects our top half to our bottom half is our core outside of our spine. Otherwise, everything is just wobbly all the time, back and forth. So what we want to try to do when we teach the body how to breathe, right? Because we breathe wrong, our ribs are not supposed to move 24/7. They're not built like that. They're supposed to breathe in excess, when we need more air than our diaphragm is able to actually do. Let's say back in caveman times, when you're running away from a saber-toothed tiger or a woolly mammoth, that's where you got to look at why our body does some of the things that it does. So we're going to teach you how to breathe right. So the way that we do that is we have to shut off the chest first and just basically talk to the diaphragm. So we're going to do that by either looking in a mirror or you look down at your hands. Either way, your hands are going to be on both. Hand on the chest like this, and hand on the core or on the stomach. Now when we breathe in, the chest isn't going to go anywhere, just the stomach is. And we're going to go like this. Now notice how when I breathe in, the stomach goes out. Breathe out, stomach goes in. Sometimes you'll find people where you actually breathe in opposite. You breathe in and it's, that's completely off. We need to retrain that. That's why we shut off that chest. So again, shut off the chest, look down or look in the mirror, make sure it doesn't move. Now, once you've mastered that, you've mastered how to shut off the chest and just engage that stomach and engage that diaphragm, which basically is the top part to our entire core. Then we have to get it to learn to talk together and work together. So we want everything to inflate like you're filling up a balloon. We're gonna go. Now, a little side note, when we are teaching the body how to breathe, we don't want to be like this. We don't want to breathe here like this. We want to be in a good posture. That's why you're here, or you're at least looking down like that. Now, after you've done all those things, you've spent a couple weeks just teaching the stomach how to breathe, how to get oxygen in and out, and you learn how to shut off the chest, and then you learn how to get everything to work together, then we need